Hello, I'm Dr. Bill Lyndon. I work in the Mood Disorders Unit at Northside Clinic, and I'm the Medical Director of the ECT services here. Today I'm going to talk about depression. Clinical depression is a very common disorder that occurs to quite a large minority of people in the community, and it's not an easy illness to understand for people in the lay community, because many people see depressed mood and depressed feeling as being a normal part of human experience, and it is. But depressive illness is not. It's not a normal part of the normal human experience. It is a clinical condition characterised by a lot of symptoms, but more importantly, it's associated with a real change in the way people feel and think and behave. There are several types of depression. We talk about depression with melancholic features. So this is the more severe form of depression, where people are very, very severely affected, and they often can't function at all, and sometimes need to be hospitalised. There are some severe forms of depression that are accompanied by delusions and hallucinations, and so that can be very severe. But more commonly, most people suffer from a less severe form of depression, and we tend to call that non-melancholic depression, and that probably covers the vast bulk of people who suffer from depression, so that they are not well, they are not functioning as they normally would, but in a sense they're on their feet and they manage to keep going somehow. It's multifactorial. In other words, it's caused by a whole host of different things. One of the most important predisposing factors for depression is genetic vulnerability. There's very commonly a family history of depression, so people who suffer from depression will often be able to say that there are other people in the family who've suffered from depression before. So there's a genetic predisposition. But there's also a big input from life experiences. So people who go through very difficult early life experiences, people who've been traumatised or abused through childhood or neglected, these people are very vulnerable to develop depression in later life. Very often depression will follow a major life event, negative events, such as the loss of someone close, loss of a job, anything that can impact on someone's otherwise happy life can lead to depression in those people who are vulnerable. The signs that people will often notice to begin with are a loss of interest and a loss of energy, so that people just aren't interested in doing the things that they normally do, like playing golf or going to movies, and they find that their energy levels are low, and they feel that they start to realise they're not enjoying things in the way that they usually do enjoy them. Sometimes they'll start to withdraw socially, so that they don't want to actually go out with people. They might avoid returning a phone call or turn down invitations that they would normally accept. They'll often then start to notice that there's some sleep changes. People start to have difficulty going to sleep or waking through the night. Very classically, people might wake in the middle of the night and be unable to get back to sleep again. And people usually are conscious of feeling low and gloomy, feeling a bit hopeless about the way things are going, and very often start entertaining some suicidal thoughts. And that's a sign, of course, that depression is really starting to become a real worry, and that treatment is really necessary. People who've had adverse early life experiences, people who've had difficult family relationships in their early life, people who've been abused or neglected, and people who tend to be highly driven people, who have high expectations of themselves. These people sometimes fall short of their expectations, and that can lead to some vulnerability. And of course, people who are in unhappy life situations, people in unhappy marriages or relationships, people who are struggling with their employment and occupation, and people who've experienced significant losses, such as the loss of a partner or family member and so on. So they're the people that are most likely to develop depression.